All right, the CDC is out with new mask guidelines as the pandemic continues to show signs of improving. Yahoo Finance senior healthcare reporter Anjalee Khemlani has the details. Anjalee.
That's right, Brian. The CDC on Friday, not just rolling out new mask guidance, but also redefining what concerning levels of transmission of COVID are. The CDC said that these new guidance will affect 70% of the U.S. population right now, moving them into low or medium areas. And that affects about 55% of counties. The redefinition really looks at hospitalization and strains on hospital systems. As you can see, low areas of concern are those with limited impact versus high areas where we know that hospitals could be strained or have limited, healthcare professionals and the like that we've seen throughout this pandemic. And so that has impacted also when we know to mask. So as we know, the Omicron wave has subsided, and we're looking at possibly a few months of reprieve before any other variants of concern come about. We've seen that pop up every 4 to 5 months. So if another one does come along, that is around the time that we can expect that. So when to mask, we look at medium areas of transmission. That is the first area of guidance. Low basically has no guidance. Medium areas of transmission, asking your healthcare provider. This is especially important for those who are immunocompromised or have other vulnerabilities, such as elderly individuals. High transmission areas is when we go back to really looking at masking indoors. And this masking is largely for indoor spaces because, as we now understand, this virus really transmits in indoor spaces a lot. And so that's sort of where the concern is. We know that the CDC Director Dr. Rochelle Walensky said on Friday that this is exactly what is needed for now. None of us know what the future may hold for us and for this virus. She said, we want to give people a break from things like mask wearing when our levels are low, and then have the ability to reach for them again should things get worse in the future. We are seeing this play out across the country, of course, noting specifically in New York City, where the mayor just announced that there will be some reprieve from masking for kids, as well as the vaccine mandates and checking in passports for restaurants and other indoor spaces that is set to go in effect on next Monday, March 7th, with a final decision on March 4th. Again, this is all aligning with what we're seeing around the country. There have been some other areas of the country which have said they're going to either wait, either based on their current level of transmission or concerns. But it's important to note that the CDC, as well as other experts, have said that if you want to mask, you can certainly remain masked for now. Back to you.
Anjalee, it's Brian. I want to ask just kind of about some news headlines that we had gotten over the weekend regarding some research into the origin of COVID-19 tracing back to China. Any more details you can provide on that?
Yes, so we actually got 2 preprints. Really important to really amplify that these are not peer reviewed just yet, but 2 new studies pointing to the Wuhan market. That market was originally thought to be the origin of the virus and the resulting, of course, COVID-19 pandemic. But what the study shows is that based on actual Chinese testing of the animals at that market, we found that there are 2 lineages of the virus that had been in circulation early on. And that's really important to note because, of course, we know that there have been some lab leak theories, and this sort of adds to the body of knowledge of the market being the original source. Much more to, of course, dig into when it comes to that. But as it stands right now, we see more promising information coming from not just the studies themselves, which have been global collaborations, but also from the Chinese themselves releasing this information. We know that the market had been wiped down and wiped clean pretty soon after the first report. So there was very little that international experts could do. But at least the Chinese have now, 2 years later, released these results, and that's helped with this body of study.